Lovely people, this is Dr. Sarit Avraham, and today I'm going to answer the question that many of you have been asking, and this is about why we do not perform root canals when we do dental crowns. Many people are not aware of the fact that we can do dental crowns without a root canal treatment. So this is why we do our best on biomimetic dentistry to avoid the need for a root canal treatment. So let's take a look. And this presentation is going to focus on why, and the next videos we are going to show you how we do it. Okay, so let's add this presentation to our show. So as I told you, this is why we do crowns without a root canal treatment. We are going to focus on this subject today. And you see here the x-rays of a patient of us who came here after she had been offered by another dental office to treat her teeth. The condition of her teeth, these two teeth in this picture, with a root canal treatment, a post and a crown, and also gum surgery. And on the x-ray on the left side, you can see that we could manage this situation without any of these treatments and just do biomimetic crowns. And this is how and why we do biomimetic crowns like this. Okay, so just I'll sip some water. The main purpose of the dental treatment, okay, before we answer how we can do dental crowns without a root canal treatment, we need to understand what is the main purpose of the dental treatment. So for some people, it's just to get rid of the pain and discomfort. But if we are watching this video, then I can totally understand that you understand that the main purpose is to keep your teeth for many years. Now, many people understand that keeping your teeth for many years, it plays a major role in our health, but I'm not sure that many of you know exactly why. Okay, so why should you have your teeth for many years? Did you ask yourself? Because that is a very important question to ask yourself. If you understand this, then you will have a better understanding of how to treat your teeth at home and also where to go to treat your teeth. So if you don't know the answer to this question, then you must subscribe to this channel and get a huge amount of knowledge to support you with your health journey. Now, the biomimetic dental approach looks at teeth and the mastication system as a whole system that is aimed to support your health and help you have a better digestion. We all know what a major role digestion plays in our health. Have a better breathing during the night sleep. Okay, it supports the nervous system and the skeletal system, and it has so many roles in our health. And this short video is not going to focus on the answers for these questions, but we are going to answer all these and talk about all these very important roles that teeth has in our health. And I urge you to subscribe to this channel so you would be able to get all this very important information if you want to have healthier and better life. Now, for conventional crowns, the problem with deep cavities is that inside the tooth, the cavity goes too close to the vital tissues, the pulp. Inside the tooth, we have the mineral part of the tooth, which is the hard stuff from the outside. We see the crown, and if we have gum recession, we would see the cementum, the enamel, and inside we have the dentin, and which is the mineral part of the tooth. Let's say 97% of it is mineral, and we have inside, if you see these black lines here, if you see my pointer, okay, these black lines is the vital pulp of the tooth, okay? Now, let's see what happens if we take out the vital pulp of the tooth, and also we will take a look on the surrounding of the tooth. So outside the tooth, if the cavity is too deep, then it goes very deeply into the gums. Okay, so what do we do with conventional crowns if we have these issues? And of course, we'll talk about what are the biomimetic solutions to this these problems. Okay, so when we need to do a conventional dental crown, then you see these yellow lines. Okay, this is a conventional tooth prep for a conventional crowns. Now, in the old ages, they thought that if a tooth is a little weakened, then we should take out the outer surface of the tooth and then replace it with a stronger crown. And the thought behind it was to strengthen the tooth, to just keep it with a stronger material from the outside of the tooth would help us maintain the tooth for longer, for the long run. Now, recent research, we are talking about the recent 30 years, yes, had shown that if we take out the tooth mineral, then we weaken the tooth, and even though we place a stronger crown material around it, then it still does not strengthen the tooth. Okay, so on the prep part, the way we need to prepare the tooth and take out the outer mineral of the tooth in order to place a crown, we understand that it weakens the tooth. Now, if we also have a deep cavity into the gum and the periodontal tissues, the gum and the bone around the tooth, then for a conventional crown, we need to take the tooth prep beyond the cavity area in order to make sure that there won't be any bacterial infiltration around the crown. Okay, this is another way to prepare teeth for conventional crowns. Another thing that we need to take into consideration. Now, if we do that, then we would most likely invade into the biological width of the gums. Okay, there should be some ratio between the gums. Okay, we don't see the gums on the X-ray, but the gums is the skin you see inside the teeth, the red tissue. So, and the gums and the bone and the tooth, they have some biological area that is called the biological width. So there should be some ratio between these three structures, okay? So if we need to prep the tooth deeper into the gums, then we invade the biological width, and then we need to do a surgical procedure which is called crown lengthening in order to re-establish a new biological width between these three structures, the tooth structure, the gums, and the bone. Okay, so this is another thing that happens with conventional crowns. Now, another thing is that since we need to take off the outer mineral of the tooth many times, I made little turquoise circles here. We need the crown preparation can many times just invade into the tooth pulp space, which is the vital part, and then in most conventional crowns you need to have a root canal treatment. Okay, and then the next thing would be to invade into the root canal. You see this arrow I made here? So this is a post that goes into the root canal after a root canal is being done. Okay, this case had no root canal treatment, so I don't have any x-rays to show you. But if you want, you can just place a comment below, and of course we'll talk about it in another video that I'll make for you on these subjects. So if we talk about, I did mention about the structural tooth strength that the conventional, the old age dentistry did crowns in a way that they thought that if we place a strong crown material around the tooth, that this would strengthen the tooth and keep it for longer years. But recent research shows that if we do a root canal, we take out the inner part of the tooth, okay? So there remains a void inside the tooth that is being filled with root canal fillings, but still it is a void. And we need to prepare and shave out the outer surface of the tooth. And we need to place a post inside the root canal system. And of course, I didn't place the structural issue that we have with the biological width and surgical crown lengthening. So all this just makes the structural tooth strength go down very extensively. And this makes a lower prognosis for maintaining the tooth for the long run. And many of these teeth, they eventually get extracted, okay? So, and if our main purpose is to keep teeth for many years, then of course, we need to understand how we can treat them in a better way. So let's see how the biomimetic approach works, okay? So if we have a deep cavity, which is close to the root canal system, okay? Now, this patient did have some discomfort. She did, let's talk about a little bit on the diagnosis of these cases. She did have some discomfort from her teeth, but the symptoms and the vitality tests we did to make sure that she doesn't have symptoms that are coming from inside the root canal system show that her pulp was vital, okay? So there was no need to devitalize the pulp with the root canal treatment. The discomfort is coming many times from food impaction, because you see there is a gap between that tooth and this tooth, and since there is a lack of contact between them, then when she chews, then food gets impacted between the teeth, and then the food impaction just really makes a very bad pain on the gums. So many times the diagnosis here is very important to understand whether the pain comes from the gums, which can feel exactly sometimes just like a root canal treatment, or from the tooth pulp in itself, okay? And so that is why we emphasize very extensively on a very thorough diagnosis of the situation before we decide how to go further on. Now, if the cavity goes deep into the gums, but the biomimetic approach, also we talked about if we prepare the tooth for the conventional crown, then we need to take the tooth prep beyond the cavity, okay? But here with the biomimetic approach, we do not need to take the prep beyond the cavity. We can just finish where the cavity finishes, and then we don't go deeply into the gums, and we do not, biomimetic approach tries to avoid the disturbance to the biological width, or the ratio between the gums, the bone, and the tooth, okay? So this is why we also don't need crown lengthening many times. Okay, so let's see how many treatments we could save this patient. Crown, okay. And the crown, we didn't say, we just used a biomimetic approach, but she didn't have to do a root canal treatment. She didn't have to do a crown lengthening, which is a surgical procedure, and she could keep her teeth for and the vitality and the strength of the tooth is kept, and this makes a better prognosis for the long term. Okay, so if we do a dental treatment just to do a dental treatment and to relieve pain and discomfort, then most probably anything we would do would just work fine. But if our purpose is to keep teeth for many years, then our approach should be more specific and have a very specific purpose in order to help you maintain your teeth for many years. So I hope that you understand now that this is why we do not do dental crowns without, this is why we do dental crowns without a root canal treatment. And this patient, of course, is now very happy. She has no pain or discomfort. We could keep her tooth vitality. We didn't do any root canal treatment. And the treatment is for us very successful. We can see here a picture of the tooth 5 years after the treatment, and everything goes very well. And there are, of course, many other ways in order for you to keep your teeth for many years from now. We will talk on this channel about why you should keep your teeth and how important your teeth are for your health, and what you can do to improve your health by strengthening your teeth and gums. And of course, we will also talk about how you can have better dental procedures that will help you keep your teeth for the long run. I hope you enjoyed this video today. If you have any questions, I will also keep a link to our Facebook group. You can join our group and ask your questions, and we will answer you. We have a very open discussion about dental materials, dental approaches, and what you can do in order to improve your health. I hope you enjoyed this video. I was very happy to be with you here today, Dr. Sarit Avraham.